Hey y'all, I just want to take a few minutes to go over what the tutorial's bedside sessions are going to be like. Very excited for this to start. So, a couple quick announcements. The students who are going to the Bronx VA, I really hope that you guys have already done all of your security clearance over there. So, if for some reason that has not gone through, please email Sarita Martinez ASAP. Uh, because if that has not gone through, that's going to be a problem for you to even start the rotation at Bronx VA. Um, Second issue is infection control module. So you guys have done this already before you even came to medical school. If you remember, Dr. Taylor sent you a PowerPoint slide, a video, and a short quiz that was developed by Dr. Burnett's on infection control. Now that you're going into hospitalized settings, we do want you to have a refresher. So on CourseWorks, on the module for the bedside, there is a infection control module. It's the same material that you've been exposed to before. So hopefully going through it this time around is going to be pretty quick. So take a look at those slides, review the video if you need to, but you will need to do the quiz, which is very short and just shows that you've learned the material. You will need to finish that quiz and submit it before you can go to your bedsides. And hopefully that won't take too much time. And in terms of the first day logistical information, so some of you will be at Milstein Hospital on Monday or Thursday. If so, just show up at Milstein 6th Garden near the elevators. Actually, just go to 6th floor Milstein near the elevators if you're going to be at Milstein at 2 o'clock on either Monday or Thursday, the day that you're scheduled. The other sites, Allen Hospital, Harlem Hospital, Stamford, Lawrence, etc., there will be a document that is going to be posted on CourseWorks later this week that's going to tell you exactly where to go, how to get there, and contact information once you do get there. So be on the lookout for that document. We're putting in some final information and verifying some information this week. So that will be ready by the weekend and definitely before the bedside starts. Take a look at CourseWorks for the logistical information. You also will be giving out thank you cards for all the patients that you work with in our course. Some of you will need Metro cards to get to sites like Allen or Harlem or Bronx VA. And some of you will need Zipcar cards, especially if you're going to Lawrence or Stamford. Sarita Martinez will be emailing you all with more information on how to pick those up. So you're going to need that for your first bedside session. Everyone will need to pick up thank you cards, but those of you at away sites will definitely need Metro cards and Zip cards. So look out for that email. That's going to go out later this week. That will describe how to get that information or get those materials so you'll be ready for your bedside sessions. So let's go on to describing the bedside sessions themselves. So the session basically is going to be taught by one preceptor, and 4 students are placed with one preceptor. You all already have been placed with your preceptor, so you should know their names and where you're going to go to meet them. And you also know that there are 4 students for each group, student A, B, C, and D. That designation is based on your last name, arranged alphabetically. When you do evaluate patients, you'll evaluate them in pairs. So every time you go, 2 students will be working with 1 patient. You can feel free to change up those pairings from week to week. It's just kind of, create the pairings in a way that feels right for you. So how do those afternoon sessions work? Basically, you'll meet your group at 2 o'clock. You will go over the plan for the day. Sometimes there'll be some educational segment for a student leader that day that they might go over with the whole group. And then your preceptor will introduce you to your patients. And In pairs, you will then do a H&P with your patient while your faculty member splits their time between both groups. You really should not spend more than 1 hour at the bedside because the patients will get extremely tired. So don't spend more than an hour. And at the very latest, at 4 o'clock, all 4 students should meet with their preceptor to do the wrap-up. The wrap-up is where you sit down, you talk about both cases, and you talk about the differential diagnosis and pathophysiology. You're going to be basing your write-up assessment on that discussion. So make sure that you have a good, thorough discussion about your cases. So let's kind of go through what that, when you're with your patient, with your other student, let's think about how that time is split. Let's just say student A is conducting the history this time, and student B is doing the physical. So you're going to start off by taking the history. Student A will take the history. While student A takes the history, student B is taking notes, making note of the history that's being obtained. Student B will also start to go ahead and try to outline the differential diagnosis. Student B is also going to be a timekeeper, knowing that you have about an hour at the bedside. So if a half an hour is passing, go ahead and let your classmate know, hey, you got a half an hour. We've already had a half an hour elapsed. Just knowing that whole hour time, you need to do a history and a physical. At some point, student A is going to feel like they're done with the history. What we want you to do at that time is take what we call a clinical reasoning time out. What that is you, student A and B, can excuse themselves from the room for about 5 minutes. If you need, take 10 minutes. But what you're going to do is you're going to take a time out. You're going to step outside the room. You're going to say, Ms. Johnson, is it okay if my classmate and I just step outside for 5 minutes? We're just going to discuss what we know so far, and we're going to come back and listen to your heart and lungs. Does that sound okay? Right? And so what are you going to do in this timeout? What you're going to do is both of you are going to stand together and say, what do we know so far? What's the history that we've obtained? Is there other history that we need to obtain still that we forgot to get? What's the differential so far? What's the leading diagnoses? And have we collected the history that is pertinent for those diagnoses? Right? So that's the conversation you're going to have outside. If you need to look something up, go to Up to Date, go to your pocket medicine handbook, because you might not have seen something that the patient has, right? Oh, what's the differential for abdominal pain and weight loss? Well, you might need to talk about it outside if you haven't done that block of BHD yet. What you're also going to do is say, all right, so our differential includes these 3 diagnoses. Student B, how are you going to prioritize your physical exam? You're going to go back in there and try to do a thorough physical, but you're also going to prioritize based on your differential at the time. Okay? So that's what's going on during the clinical reasoning timeout, and then you're going to come back in the room. Student A may complete the history if there's a few questions that need to be asked still. And then you're going to hand the baton over to student B. Student B then is going to do the physical exam. Meanwhile, student A is going to take notes, going to keep time, and it's going to help keep you moving along. I think it's fantastic if student B can also, or student A can also give feedback to student B. Hey, we learned the heart exam, to listen to the aortic area, hold the stethoscope up here, not down here, right? So be engaged, but that's going to be a time when student B does the physical. Student A is taking notes and giving guidance if needed. As I mentioned down here at the bottom of the slide, feel free to switch roles next time around. Okay. Now you're going to meet up at 4 o'clock at the latest for a wrap-up. All 4 students and the preceptor sitting together. Each group each pair is going to present their case. You're going to go over the differential. The faculty member may give you feedback on what he or she observed at the bedside. You may decide to go back to the bedside if there was an interesting physical exam finding for all students to listen to or look at. Faculty member may wish to take you to the electronic health record and pull up a chest x-ray because you heard crackles, right? Or look up the echo result because you heard an S3 and saw an elevated neck veins. And what you're going to do after all that is done is make sure to sign and give each patient a thank you card. Have the faculty member sign it as well. This is a long-standing tradition in our course. When you get the cards, you will see what it says inside, which basically says, look, we realize that you are sick, and even though you're sick, you have been so generous with your time and generous with allowing us to examine you. And you are considered a teacher. You're considered one of our teachers in our path to becoming physicians. So make sure to give that card to your patient. It makes a difference. The patients really appreciate it. Then, after the session is over, you're going to do a write-up. Okay, so check out CourseWorks. There is a packet in there called Teaching Tools that has sample write-ups. It has the write-up rubric. So it kind of shows in a checklist form what makes a good write-up. Couple tips about the write-up. Please do not use patient names, because if you do happen to lose your write-up, if it's printed out or happen to email it to the wrong person or something like that happens, we don't want that patient information floating around. So when you do the write-up, student A and B are going to share notes. However, they should write their write-ups independently. We want you to develop these skills independently so that they become strong and firm, and that you can actually employ these skills when you go to the MCY. If you don't develop these skills now, you're going to have a very hard time in the MCY when you transition. So make it easy on yourself. It's hard now doing it on your own, but do the work now and you'll make it easier for yourself later on. You will email your write-ups to your preceptors. If it's a Columbia email address, please send it to and from a Columbia email address. If it's outside, use the hospital email address for the faculty member so that it is HIPAA compliant. Talk to your faculty member. If they do not have a HIPAA compliant method of getting the write-up, you may need to print it out for them and give it to them. And those are the timelines that we want you to get the write-ups to them. Monday students get it by Friday. Thursday students get it by Monday. We don't want these write-ups to linger. It becomes harder to do the longer you wait. And this is absolutely central to your skills and habits as a professional. So being able to turn this around in a few days is a very important part of your training. And your preceptors will comment on this at the end of the semester regarding the timeliness of your write-up submissions. Bedside 1, your very first bedside, is a little bit different than the rest of the bedsides. I kind of described to you what the rest of the bedsides look like. Bedside 1 is special. How that is going to work is you're going to have 2 patients, but the first patient, your preceptor is going to do a history and physical, not you. So you will watch your preceptor do a focused history and physical. They're not going to spend an hour doing this. They're probably going to spend maybe 15, 20 minutes max doing this, but you get a sense of their approach. How are they developing rapport? How are they using open-ended questions? How are they following the dialogue and pursuing diagnostic thinking? How are they then tying that to a purposeful and focused physical exam? So we wanted to start off by you watching a seasoned physician doing this physical. And then we're going to go to patient 2. In patient 2, everyone is going to play a part. So we'll start with student A taking the history, right? So student A and everyone, please review the elements of the history. The more you memorize this and just kind of get this in your system, you will not have to, scratch your heads and get lost when you're actually at the bedside. It will just be a part of you. Student B then does the physical exam, starting off with the head, ears, eyes, nose, and throat exam, HENT exam. Student C does the cranial nerve exam. Student D does the rest of the neuro exam. Do not do the gait exam. Do not do Romberg. Base this exam partly on how well or sick the patient looks. You may need to truncate certain parts, but this particular session, the physical exam is not going to be that long. It's only HENT and cranial nerves. So I think you're going to be fine. What I forgot to put on here is that student B should also take a blood pressure. Take a blood pressure and check a heart rate. So that's what student B is going to do in addition to everything else. Hope that makes sense. This is a nice way to kind of divvy up the work in the first session, and everyone shares the work. And in this particular session, the students will do the write-up in pairs. Okay, so you'll pair up, do the write-up in pairs, and submit it to your preceptor. This is the only time you will be doing a write-up in pairs. The rest of the semester and next semester, you will be doing write-ups independently. Right? So that is it. Sorry to end with a blank slide there. So that's it. Have a wonderful week. Please be in touch with me, Dr. Kessler, or Sarita Martinez if you have any questions. Bye-bye.